Hi everyone, my name is Casey Carmona. I'm so sorry that I can't be with you in person today, but before I get started, I wanted to share a special thanks to Marin for making this still happen. Thank you so much. 2 years ago, my husband comes home from work and says, Casey, guess what? My new boss wants to take us out to dinner, and he wants you to choose the restaurant. Well, at the time, I was 16 weeks pregnant, and I thought to myself, okay, free, company card. Of course, I'm gonna choose a fancy steakhouse. So a few weeks later, we're sitting at that fancy steakhouse. There's my husband, his boss's wife, and myself. A waiter comes and shows us a drink menu. There's some remarks of, oh, Casey's pregnant, she can't drink. The waiter says, oh, really? Is it your first pregnancy? Which I quickly quip back, no, it's my third. And his response was, oh, well, how old are your other two? How old are your other two? What a normal question. What an innocent question. But for those of us here today, that question is anything but normal. That question is filled with such anxiety and trauma and trepidation. See, if you're here today, whether in person or virtually, you're part of the club that nobody wants to be in, nobody asked to be in. Whether you're a parent or a grandparent, a sibling, a relative, friend. And I have scoured the English language trying to find words that can convey condolences of some sort, because it seems like in our language we have two words that will never quite do it justice. But I'm sorry. I am sorry. See, my husband and myself and our two children and grandparents and siblings and relatives, we're also part of the club. And today I'm going to be talking about my son, CJ. But in this talk, I hope that you would be able to insert your own child into these stories so that together we might be able to remember and celebrate. Today, we'll first look at the diagnosis and those early days in the hospital. Then we'll discuss our time in the hospital and specifically the people that made it so memorable. And finally, we'll talk about what it means to parent a legacy. It was the best of times. It was the worst of times. It was October of 2020. Now, some of you might be thinking, oh my gosh, pandemic talk? No, I'm having heart palpitations. Good thing we are in a room filled with cardiac folk. Yeah, October 2020, my husband and I thought it would be a great time to leave our family, our friends, our community in Nashville, Tennessee, and move to Atlanta, Georgia, where we knew not a soul. Well, Teddy, our firstborn son, was 6 months old. I was 20 weeks pregnant with our next child. And 8 days after we moved to Atlanta, Georgia, I find myself sitting in a midtown medical high-rise. I've been there for 7 hours, and I'm thinking to myself, somebody's gotta have to come in and tell me what's going on, mainly because it's 4:30 and I'm pretty sure people wanna go home. Sure enough, a woman comes in, and what she said reverberates within me still today. She said, hi, my name is Dr. Bedell, and I'm seriously concerned about your son's heart. Do you have words that shake within? Because it was so big, it's so, the magnitude is so great that it can't ever quite soak in. So instead, it just rattles about inside. Do you have these words? Hello, my name is Dr. Bedell, and I am seriously concerned about your son's heart. See, that these words that we were thrust into this journey that no one is ever quite prepared for. And the very next morning, we find ourselves here at Eggleston in the waiting room. And I'm thinking to myself, what am I doing at a children's hospital? I've never been to a children's hospital. This is crazy. And how could I have known then that this would be where the government would deem my son's home? We started doing these fetal echoes. We'd have them every few weeks, and it's really for the doctors to prepare for the birth and the surgeries coming up and just seeing exactly how complex the heart was. And I remember at one of these fetal echoes, they would take sometimes a few hours trying to get all the details. One of the sonographers, Eric, he starts telling me all this data, and honestly, I don't even know what he was trying to tell me because I stopped him. And I said, listen, that's great, but I'm gonna leave all the medical jargon to you and the doctors and the professionals. See, it's my job to love. I'm the mom, and it's my job to love. Isn't that so sweet? Look at that, and I'm like, Casey, so naive. Because I think it was just maybe a week after CJ was born, for sure just a couple days after his Norwood procedure, his open heart procedure, did I realize, oh, in order to love my son, I am going to have to learn. I need to know everything that these doctors know, because I need to be able to communicate to them, and I need to be able to understand what they're telling me. And so began the next part of the journey, learning all medical things. Us as cardiac parents, we're amazing. We pretty much went to medical school without having gone to medical school, right? We know so much. We know the anatomy of the heart. We could tell you all about the 4 chambers and probably even sketch it out for you. We know the difference between a PICC line and a central line. We could tell you all about incision care. We know how to put on telemetry patches and read it. We can even put on a pulse ox and read that too. We know how to insert medications and food through an NJ tube, an NG tube, or a G tube. Speaking of medications, we know them all. Heparin, Lasix, Carvedilol, Digoxin. We know exactly how much needs to be administered and when, and if it needs a double cosign. We're incredible, you guys. We're so good. You didn't know this, but today when you leave, you're going to get a certificate from the Casey Carmona School of Medicine. It's not yet accredited, but I just thought that you needed some recognition, and me too, for all that we've learned. So you're gonna get a degree in cardiac stuff and a minor in art. Congratulations. Now, all jokes aside, this next part I debated about saying, but I think it's really important. We had to learn. We had to learn because we watched our children struggle. And I don't know about you, but for me, that's the thorn in my side. That's the pain that I live with, the suffering. But here's also what I know. It is this paradox that is beyond this earth. But when there is great suffering, there is an even greater love. And the love that was pouring out of not just me, but my husband, my family, our community, the folks here. That's the greatest thing we've ever seen. And I think it's because of that suffering that we were able to love and do more than ever thought possible. And the love we felt back from our children was so great. This love is so much bigger than any suffering possible. And it wasn't just from us, right? It wasn't just from our family. I am positive you are here today because you witnessed someone here at this hospital that gave your child or yourself love. Whether it was a small act of kindness or great compassion, I think you witnessed it. I know I certainly did. My first one I remember was this fetal echo, and Lorelei Castillo, who was in charge of the fetal medicine program, I remember coming in confessing to her how difficult it was to only see half of my son's heart up on that screen every time we had those fetal echoes. She said, "Casey, no big deal." She took a remote control, turned off the monitor, said, "You don't have to see it." Oh, what an act of love. I think about Danielle Andrews, who now is in California. She was CJ's primary nurse in the CI. And she said, "Casey, mother's intuition is always right. Whatever you do, make sure you communicate, advocate to the doctors because you're right." That knowledge made me a better mom. And I'm so grateful for it. I think about Meryl Presley, who one Wednesday afternoon, she worked her tail off to make sure that my son had months of living instead of just minutes or hours. I think about Dr. Buto one Friday afternoon, who sat with me for an hour and said, "Casey, I think this is a little more than hypoplastic left heart. And I want for you to be prepared for what's coming." I think about Analia and Jess on PT, who gave us so much, who worked with our son every day. And I got to see CJ do things that I never thought possible, like this. He stuck out his tongue. It was amazing. I think about Megan on the PAC team, who gave us such incredible language that when it was time to bring our son on hospice care, home on hospice care, we knew what to say and we were ready for it. I think about Callie O'Connor, who came in one day and said, "I know you didn't ask for this, but I think you're going to want it one day." And she handed over my son's beads of courage. She also gave me a box of cookies that I desperately needed. I think about Dr. Alexander, who came in every week, sometimes a few times a week. I think she was supposed to be there for my son, but she was really there for me because I needed her real bad. I think about Katie McAlley, who would sit and weep with me. And I think about Nicole Coolidge, who to this day, I can pick up the phone and she'd be there. Day in, day out, night or day, she was in our corner advocating for my son. And for that, I'm forever grateful. What tremendous acts of love. I know you have them with the people that cared for your child. And it's these acts of love that have truly changed us, helped us, encouraged us, allowed us to love even more. And the love doesn't go away. I don't know about you, but sometimes I think to myself, I have so much love, I don't know what to do with it. Because death ends a life. It doesn't end a relationship. I remember after CJ died, our hospice nurse, Lenise Shortell, who's one of these angels on earth, she said to me in Cortland, she said, "You now parent a legacy." A few weeks ago, I asked my husband, what does parenting a legacy look like? And he said, I show up every day for our children and for you in honor of our son. And I see it. I can't thank him enough. I used to think parenting a legacy meant you had to have hundreds of thousands of dollars and name a wing of a hospital after your loved one. But now I see parenting a legacy as something very different, something much smaller. I see it as our family, as this great big woven tapestry. And the weaving is continuing on. And just because someone is missing doesn't mean that the weaving has to stop. In fact, you have to keep it going or the art would not be finished. The tapestry has to be finished. And so for me, parenting a legacy looks like adding in these small things that keep our son woven into our family. It looks like this. Adding our child's name to a Christmas card. Because if we don't, who will? It looks like when we do family portraits, always having a lovey or a stuffy or a photo of our child. Because if we don't, who will? Looks like giving a symbol through a cardinal or a butterfly or a dragonfly. And every time we see one of those in nature, we say, "Hi, babe." Teaching our children to do the same. Because if we don't, who will? It means on birthdays, getting out the big memorial portrait and having birthday cake. And on anniversaries, letting out balloons. Being generous. Because if we don't, who will? And it means when a waiter asks you, how old are your children? You answer honestly. You say, my firstborn son is 2, and my secondborn son died in May of 2021. He was 100 days old. Because if we don't, who will? Yes, parenting a legacy is hard and at times incredibly awkward. But parenting is hard. And it's that people aren't ready for the truth that we live. I'm not saying parenting a legacy is easy, but my hope is that if we all do it together, we'll be stronger for it. I think best news is that you're here today. What a great act of parenting a legacy, that you showed up. And we're stronger for it, for showing up for our children, for one another. Because of that great love, that great love. It's that love that never ends. Thank you.